Today's presenter is Kristi Caracappa. Kristi is the Health Insurance Information Service Coordinator for Washington Hospital. She has held this position since 2009. Kristi provides information to community members to assist them with making informed decisions regarding health care coverage. Kristi can provide assistance with Medicare, Medi-Cal, as well as private insurance and other government or community-based programs. Kristi is a certified enrollment counselor for Covered California, California's health insurance exchange. So tonight, I'll be talking about mostly Medicare coverage, and during our question and answer session, if you have questions about other related insurance, we could do that. And I just have to share something that was kind of ironic. Health insurance is very broad with a lot of multifaceted information, and before I started, one of our techs here had brought up, I just got a big envelope of information and it's very overwhelming, and I don't want to look at that. And I said, throw it on my desk, I'll take a look at it, because I do it all the time, so I know what to look for quick. Went back to my office and I got a text, and I want to share it with you. It's from my daughter. She's at the University of Arizona, and I asked her what she was doing earlier. She said, "This healthcare class is really boring." I said, so I sent her a picture of this slide right here. I said, "Just getting ready to bore a bunch of people myself." And she said, "LOL, I feel bad for them." So I thought that we could just start off, if you're feeling overwhelmed or, somewhat sleepy by the subject, I'm paying a lot of money to have my daughter do the same. So anyway, that's why they pay me to be here and help you navigate this. So we'll go through Medicare and other facets of it. So I'd like to first talk to you about the service that's provided here at Washington Hospital, the Health Insurance Information Service. It's unique. That's not found at other hospitals in the area that I know of. We are a free, confidential, and unbiased health insurance counseling service. By unbiased, meaning I counsel Kaiser members as well, and people that are maybe using other facilities that aren't affiliated with Washington. Our goal here as a health insurance information is just to make sure that you guys stay healthy and use your health insurance, to its maximum. And then Covered California Enrollment. I'm a Covered California Enrollment Counselor, which is the state's exchange, insurance exchange. Medicare Enrollment Counseling, doing a little bit of that today. Medicare Part D enrollment during when you first turn 65 or become eligible, or during open enrollment, which is coming up. And Advanced Healthcare Directive and Pulsed Information. You're going to be hearing more about Advanced Healthcare Directives and Pulse in a little while, and if it's something you want to go over one-on-one, you can call me and make an appointment, and I could kind of go over the forms with you and answer any questions you may have about them. Also, Michelle will be able to answer questions during the seminar as well. So I want to start off with Medicare, assuming that most of you may be caring for somebody who is, if they're not over the age of 65, or let's say they are and they have Medicare, you also may be caring for a child or a younger individual who is disabled, and in that case, they more than likely qualify for the Medicare benefit. As you can see here, this is the Medicare card, and it has the A and the B on it. And when you have Medicare, there's basically 3 different ways you can take your Medicare. The first way is just having your Medicare A and B. You have your card, and you just use the services, and you pay the co-insurance and the deductibles. It's not the most advised. The second way would be to this step here, which would be having original Medicare. You have your A and B, and again, I mentioned deductibles and co-insurance. You want to have something that covers those, so you would want to get a supplement. And then Part D, so I kind of skipped that step. So Part D is your prescription drug coverage. So if you're caring for somebody, you want to know how they're taking their Medicare. If they just have that Medicare card, is there anything that goes with it? Another possibility they may have is the Medicare Advantage Plan. An Advantage Plan is, I like to use this as an example of Kaiser, because in Fremont and the Tri-City area, Kaiser is very prevalent. So usually if you don't have a PPO or a private HMO, you may have Kaiser. And what a Medicare Advantage plan is, it combines your Medicare card A and B and the D, your prescription drug plan, into one program. Okay, so Kaiser, if you're a member, you or the person you're taking care of is a member of Kaiser Senior Advantage, they have a Part D drug plan built in. Okay, they may also have other services that they're paying a little extra for within that, and that could be dental and vision coverage. Advantage plans, so they basically you're signing your Medicare A and B over to the Advantage plan. Medicare is saying to the Advantage plan, oh, okay, so you're going to take care of Mrs. Smith and all their medical needs. We're going to go ahead and pay you to take care of them. So that's kind of how that works. And here, this shows step 2, adding a Part D. In this area, all the Advantage plans do include a drug plan. Okay, so you either have your Medicare with a supplement, or you have it wrapped up into an Advantage plan. So you'd want to find out the person you're caring for what they have. So other insurance, if they're not just having their straight Medicare or they don't have an Advantage plan, in some cases they may have a retiree insurance plan from an employer. Okay, and that could be acting like an Advantage plan. It could be acting like a supplement, and it's really hard to know unless you have the benefit packet or go to the website and find out. If you have Medicare and a group insurance from a family member, so perhaps you're taking care of somebody who has a spouse who is still working, and they have a group plan, and that person might be under the group plan and may have Medicare with that. Okay. TRICARE for service members, TRICARE for Life acts as a supplement to Medicare, so if they have Medicare, then they would have, and TRICARE, that works very nicely together. It's one of the best military benefits. Or they might have VA coverage, and VA coverage from the Veterans Administration. If they have that, they're not required to have Medicare. It is recommended, it is recommended by me, that you have your Part B, because if your benefits change with the VA, where every year, I think it's every year, they reassess what your benefit is, and the benefit drops and it's not as much as you had before, and you think, well, I should go ahead and get that B now. You can do it during the enrollment period, but there will be a penalty. So I always recommend if you have VA, go ahead and have that Part B. Okay? And with the VA, if you're using VA services, you need to use the VA facilities, which here we have a Palo Alto clinic. Otherwise, it's Livermore and Palo Alto. I don't think it might be built. There's one in San Leandro that's, I guess, a pretty big facility that they're putting together. So that's another way. Also, I just want you to keep in mind, if I mention anything that applies to you, and you think, gosh, I want to know more about that, you can always call me later and have a one-on-one appointment too. So we're just going to go through this, and there's many, every one of you may have a different situation. That's why the insurance is so complex, and we have the service. So I'm going to go ahead and talk now about the Medigap plans. So we talked about having Medicare A and B, and then a supplement. The supplements typically pick up the deductibles and co-insurance, okay? So as a Medigap plan picks those up, they complement your A and B, okay? So you can go anywhere, any doctor, any facility in the United States that takes Medicare, and your supplement follows it. It doesn't matter who you buy it from, it will follow you. I put up here Plan F and Plan N. Those are the most two popular plans purchased in this area. Plan F, I call it the gold standard, because if you have Medicare and Plan F will cover everything that Medicare covers, everything extra. So if Medicare says you're in the hospital and Medicare covers 80%, the Plan F will pick up 20. As long as it's a Medicare covered service, Plan F or Plan N will pick up the rest. The exception with N is just a small deductible at the beginning of the year and a little bit of a copay at some of your doctor visits. So services, if a service I mentioned is covered by Medicare, then the co-insurance will be covered. And those plans that are lettered F, they're actually A through N, they're sold by private insurance companies. And when people say, well, how do I know which one to go through? I always recommend a broker. The reason being is the broker will be able to ask you, well, are you going in on your own for that supplement, or is it you and a spouse? Are you having it? Do you like to go to a gym? Some of them offer a gym membership, and you might be caring for somebody who it is recommended that they have some sort of activity in a gym with a pool or something, and the supplemental plan could be useful to them for that. So Part D drug coverage. Part D drug coverage is very necessary to have. It's when you first sign up for Medicare, you have 3 months to get your prescription drug plan. And if you don't sign up for it when you're eligible and you sign up later, there would be a penalty. So I highly recommend you have a drug plan. So if you're caring for somebody with their Medicare with a supplement, they should also have a drug plan. Okay. Each plan is different, has a different price structure. They have different monthly premiums. They range from around $16 all the way up to $200. The average plan is about $25 based on generic medications. If you have more brand names medications, then perhaps the monthly premium would be a little higher. And they're structured by medication tiers and network or preferred pharmacies. So sometimes people want to go to a pharmacy because it's close to their home, or it's where they grocery shop. For example, Raley's. Raley's has their own pharmacy. They're very customer service oriented, and they're very local. So people might want to go pick up their prescriptions there. But when we look over their prescriptions and the different plans, it might be better for them just to run over to Walgreens and get them. And I'm not saying that Raley's is the most expensive. It's based on the plan and what medications you're taking. That is another service we provide, is going over your medications or the person you're caring for, their medications, and helping you decide if that's the best plan for them. And it is important to review your Part D plan every year during open enrollment, which is coming up October 15th through December 7th. So even though you might be on a plan now, or your person you're caring for might be on a plan now, that their drugs are being covered very well. But if you don't open up that packet and look up their medications, they could be dropped off of the plan, so they're no longer covered. They could be tiered higher, so now you're paying more. Maybe the person is taking a brand name medication that works really well for them, and they tolerate it well with side effects and such, whereas a generic one has a different formulation, they might not like it. So it's really important for you to take a look at that every year. So Part C or Medicare Advantage plans, which is the other way that you could take Medicare. Part C plans, that they combine your A, B, and D, and I used an example of Kaiser because they're big in the area. The other ones that are pretty prominent are United Healthcare, which is also referred to as Secure Horizons, and they've been around a long time. Easy Choice is a newer one to the area. It has 3 different premiums with different ranges of coverage. If you were in the seminars before, one of the speakers did talk about that, the different ranges of coverage within that. They're sold by private insurance companies, and then you have to usually stay within in this area you have to stay within a group. So if you're with Kaiser, most of you know how Kaiser works. You have to stay under the Kaiser umbrella. Kaiser has a lot of facilities all the way here in the area from San Leandro, Antioch, Brentwood, down to Milpitas, Salinas, I think, is as far as they go here. So they're quite a broad range of where they go. If you are under Secure Horizons or Easy Choice, you're going to need to choose a medical plan, such as the names that would be out there would be Hills Physicians, Palo Alto Medical Foundation. They're a medical group. And there's a couple others in there too. Those are the most prominent ones. And you have to stay within those groups. So the advantage, they call it an advantage plan. It's actually more of an advantage to have a supplement because you can go to any doctor that takes Medicare. When you have an advantage plan, you have to stay within the group. So if you're caring for someone and the doctor says, I'd really like them to be evaluated by a specialist, you need to go to the specialist that's in that group. Usually the doctor, because he's in a group, or she is in a group, he or she will know where those specialists are. Okay, so if you have a specialist that you'd like the person to go see, but they're not in the group, that's where it's just more limiting to have. Okay, and it's important to check with your provider to make sure they accept your advantage plan. So if you you have a family member that moved from the area and you're getting them signed up for a new plan here, you want to check with the doctors and the providers that you are comfortable using and say, hey, what do you recommend as an Advantage plan? Who do you take? And that's the direction you would want to go. And I also am available to help you look at those on the Medicare website, okay? And it's nothing magic that I have. It's medicare.gov. I just know how to navigate it, and I can help you do that and train you so you can do that at home as well. We're not going to do that tonight. They only gave me 20 minutes. All right. Skilled nursing facility coverage is, I think, one of the most confusing questions that I get. But this is right from the Medicare book. Skilled nursing, if there's benefit periods, which I'm going to have, and you have it in your PowerPoint, and I think it's something that I actually keep taped up on at my desk because it's somewhat confusing. So, a skilled nursing facility, for the first 20 days, it's zero cost for that benefit period. If you're in there from 21 to 100 days, it's $157.50 a day. That's your coinsurance. That's your portion. So they might be charging you $500 a day, but you're paying $157.50 up to 100 days. And then after 101 days, there's Medicare no longer covers. Okay. Now, while that seems, and it is very scary and a very high number, especially that 101 days, that's where it kind of goes beyond my scope because that's really long-term care. The 157 is covered if you have the Medicare supplement with the plan F or N. That is coinsurance, so that would be covered. So if you were in a skilled nursing facility receiving skilled nursing benefits, that $157.50 would be covered. Okay. If you have an Advantage plan, that's another thing you want to look at. An Advantage plan has to at least cover what Medicare covers. If you have a Medicare and You 2015, soon 2016 pamphlet, and it says that they will pay 80% up to so much, and then you pay 20%, that Advantage plan must pay at least 80%. So anytime you're looking at an Advantage plan, it says you pay 20%. That means that they're really not picking up any extra cost. Medicare's picking up that 80%, and it's not really covering that extra benefit. Whereas with your supplemental plan, it will cover it. It always covers. That goes with skilled nursing. When you go to the hospital with a supplemental plan and you have the Plan F, the full coverage, you're not going to pay anything. If you look at your Advantage plan, they range from $0 to $100 to $250 to $350, usually no more than 7 days, and there's a maximum out-of-pocket expense. So money you might save being in an Advantage plan can be used up very quickly if you're hospitalized. Okay, so that's why the Advantage plan, the supplement may cost a little more, but it pays for itself in the long run. So back to skilled nursing facilities, your zero, no copay coinsurance for each benefit period of 1 to 20 days, and then 21 to 100, that $157.50. So your goal is to find out, what do I need to go with my Medicare to get that covered? Okay. So we want to talk about benefit. What is a benefit period? It's the way original Medicare measures your use of hospital and skilled nursing facilities, which they call them SNFs. I don't really like that, but they're SNF, SNFs. A benefit period begins the day you're admitted in an inpatient in the hospital or SNF, and the benefit period ends when you haven't received any inpatient hospital care or skilled nursing for 60 days in a row. So my understanding is you could be in a skilled nursing facility, but maybe you're not receiving skilled nursing care. Maybe it's a little bit of a long-term care because you can't go home because there's not somebody there to take care of you. So then that becomes more long-term care, okay? And that's a different coverage altogether. And I could refer you to somebody to help you with that, but that's actually the scary piece of elderly care and being in a skilled nursing facility. That's when Medi-Cal can come into play, and that's another tricky little piece, and it depends on the income of the individual. So the benefit period can start over within the year. So your benefit period is not per year, it's per period of care. All right. So as we go on to extra help, we're talking about Medi-Cal, which is also Medicaid is the federal name, and California is unique and adopts their own programs like Covered California and Medi-Cal. So Medicare Extra Help is a Medicare program to help people with limited income and resources pay for Medicare prescription drug program costs, such as premiums, deductibles, and coinsurance. Can be Medi-Cal assistance, and you can check with your local Social Security office or go online to socialsecurity.gov. Social Security website's very handy, easy to use. Up at the top of the web page, it'll say benefits, and if you click on that, it'll say extra help, it'll say Medicare, and you could actually apply for those benefits online. So if you think you might, you or a person you're caring for might qualify for benefits, it's worth going online and trying, or simply make an appointment with the Social Security office, which I've done it a few times, and might take a few days for you to get in, but once you're in there, I find our Fremont office to be very, very helpful. So you might want to try that. So qualifying for Medicare, who qualifies? If you're eligible for premium-free Part A, if you're 65 or older, and you've paid your Medicare taxes for at least 10 years or 40 quarters, and you are receiving retirement benefits from Social Security or railroad retirement, you or your spouse had Medicare-covered government employment, or if you were a kidney dialysis or kidney transplant patient, you would qualify for Medicare, okay? Also, if you are qualified as disabled through Social Security for 2 years. So if you find that the person you're caring for, I actually had this happen. I have a family friend whose relative I had met, and he had been injured. He was as a young man of, I want to say like maybe in high school, and he was in his 50s, and he did not have extra benefits, and they were talking about how it was starting to get difficult to pay for things. And I said, he's not on Medicare. He clearly can't work. His cognitive skills were getting worse and worse. So I said, why don't you talk to the doctor about it? I don't know why anybody hadn't caught this before. I actually went with them because as a learning experience, so I could share with you. She allowed me to go with her to Social Security, and they found that he should qualify. They ordered his medical records, and he actually started on Medicare the next month because he'd clearly been disabled for over 2 years. He'd been disabled probably 15, but his parent wanted to, she didn't know, and she just kept taking care of him. She had money, and he lived with her, and he could drive and everything else, but he was not able to work. And now that those benefits, as he's gotten deteriorated a little more, he's in a wheelchair, those benefits have just been a really, really big help. So if you think they might be due to you, it's just a phone call away. So resources, so you have them printed out in your handout. We have the Medicare.gov website. I use it every day, all day. Just type in what you want to know, and lots of PDFs will come up in brochures. Socialsecurity.gov, and the phone number is there. That's the number I call to get a hold of the Fremont office. And then now you have my phone number. Feel free to give me a call. Thank you for your time.